Dear friends, smoking and plastic surgery. Okay, a lot of people come and say that, doctor, don't worry about it. I went appendectomy without any problem. I thought I'm a smoker. It's not a problem. Like other surgical procedures are different, and plastic surgery is different in this aspect. Say, example, you have a cake in a plate. Okay, the appendectomy is like making a cut directly through the cake and going and hitting the plate. And they're not going to middle with the middle layers. But say example, you go every layer of the cake and dissecting it. That is what the plastic surgery. Okay, what does smoke contains? Smoke in any form. Say example, tobacco or even the electronic e-cigarettes, nicotine gums. Everything has one thing common. That is nicotine. The nicotine does lot of effects on the blood vessels. Okay, that each layer of the cake. Say example, the skin, underlying the skin, the blood vessels are running, underlying the muscles, blood vessels are running, the fat layer, blood vessels are running. So each layer we are dissecting during any surgeries like a facelift, neck lift, breast reduction surgeries, tummy tuck surgeries, liposuctions. That level, each level we are dissecting. So what happens? We are damaging the blood vessels here and there. Okay. The nicotine, what it does is, if blood vessels, say example, one big straw is like a blood vessel. The nicotine make it smaller straw. The effect of the nicotine is the big straw become a smaller straw. So what happens? The blood flow to the particular area will be less. So because of the less blood flow, less oxygen to that particular part. So because of the less oxygen, the tissue will die. So that's what happens in smokers. If you are not stopping it, it leads on to a lot of complications. It delays the wound healing. It increases the scar and it increases the pigmentation. It produces more bleeding during surgery, and it will not allow the wound heal properly. So like the skin go for a necrosis, death. We have to do a regular dressing, and it creates a lot of complications in plastic surgical side, as well as the anesthesia aspect. Even the lungs are so hyper reactive. As soon as they intubate, that give anesthesia, they react differently. It sometimes lead on to a very lethal complications. So when you're going for a plastic surgery, don't hide anything with the surgeon, because a lot of people, they know that they don't operate when you smoke, so they try to hide and cheat. So you are cheating yourself. Are you ready to lose your life? Ask yourself how much we are idiotically behaving with the plastic surgeons. So tell the truth. The ideal will be 3 to 6 weeks prior you have to stop smoking, and 3 to 6 weeks later you have to resume it, but better to stop it. Smoking has a lot of complications. If you take the textbook, 2000 diseases we have, 1500 diseases are because of the smoking. During exam time, if you don't know the answer, we write cause of the disease is smoking. You're 90% of the time correct. Why you want to stick on those bad habits? Okay, just quit smoking and approach a plastic surgeon. See, sometimes smaller plastic surgical procedures, yes, we do agree, 1 week or 10 days, but that's not ideal. But when the time restrictions, because they come on holidays, so in smaller cases we might say okay to smaller plastic surgicals. Even 1 week they stop smoking, but ideal will be 3 to 6 for any major plastic surgical procedures. Thank you.